Alright, so we're going to be doing a respiratory and neuro assessment today. First I'm going to start off by asking some questions about any issues with your respiratory system in the past. Do you have any history of asthma?
No.
Any history of exposure to tuberculosis, allergies?
Yesterday I may have been exposed to tuberculosis.
Alright.
Not sure yet. For real.
Not good.
No.
I'm going to ask some questions about risk factors. Do you smoke at all?
I used to.
You used to. For how many years?
Like 7.
7, and how many packs a day?
A whole lot. Probably at least a pack.
Well, it's a good thing you quit.
Yeah, I quit 6 years ago.
Very good. Do you work in any environmental conditions that may be hazardous to your breathing?
Yesterday, whenever I work, but yesterday I might have been exposed to tuberculosis.
Can you just tell us where you work?
I work at Geisinger Medical Center.
All right, I'm going to do a respiratory assessment on you. First things first, I'm going to listen to your breath sounds.
Okay.
If I can just have you turn around and
So,
listen
okay.
to your back first.
Okay.
We'll listen in 10 spots, and I'd like you to take deep breaths as I do so.
Okay.
Deep breath. Very good. I listened in 10 fields on each side. Breath sounds were bilaterally clear. Next section, I'm going to have you turn back around. I'm going to assess for chest expansion.
Okay.
In doing so, I'm going to place my hands on either side, and I want you to take a nice deep breath. And once she does so, my thumbs do separate equally on both sides. All right. Now, I am going to actually have you turn back around again, because I'm going to assess for tactile firmness, in which I'm going to place my hand over the lung fields, and I'm going to have you say 99.
Okay.
I'm going to feel for any.
99. 99. 99. 99. 99. 99.
All right. And that is negative for any pathology.
Good.
I'm going to perform a neuro assessment on you. Again, I'm going to ask any questions pertaining to your history with the neural system, any history of seizures,
No.
headaches.
Not really.
No.
Just like normal, like once a month maybe.
Okay. Any history of spinal cord injury?
Nope.
All right. Any history of meningitis?
Nope.
All right. Risk factors associated with the neurological system. Do you consume any alcohol?
Sometimes, but not a lot. Like, I don't know, maybe once every 2 or 3 weeks.
Okay. Very good. Excessive alcohol can cause dysfunction in the neural system. Any problems with balance?
No.
Okay, very good. All right, to start off
But
with
one day I will have dementia. I forget everything. Just throwing that out there.
Alright. Start off, I'm going to ask you to tell me your name and birthday.
Amanda Scavage, 1586.
Alright, do you know what today's date is?
Yes, I actually do today. It's April 17th, 2014.
Very good. And
I know where I am.
I was going to say, you know where you're at right
I'm
now.
at my house.
Very good. So, patient is alert and oriented. Alright, I'm going to have you grasp my fingers for me. If you could squeeze my fingers. Grasps are equally strong. And now I'm going to test your feet. Plantar. I'm going to have you push down like you're pushing a gas pedal. Equal and pull up. Very good. dorsiflex and plantar flex are equal and strong bilaterally. Alright, now I'm going to start testing your cranial nerves. We have 12 cranial nerves. First, I'm going to start out with your olfactory nerve, cranial nerve number 1, which tests your smell. So, what I'm going to have you do, I have a scent here. I'm going to have you occlude one nostril, and I'm going to present it to your open one. I want you to tell me what the scent is. I'm going to do so on the other side as well.
Okay.
Alright, so if you would occlude one nostril.
I can smell it even though it's half blocked because I'm sick. It's peppermint.
Okay. Occlude the other side.
Peppermint, that's the good one.
Alright, so again, she said she could not smell it as well on the left side due to her nose being blocked right
yeah.
now, due to allergies,
Sinus infection.
sinus infection.
Yeah.
Very good. Alright, to test your optic nerve, which is cranial nerve number 2, I unfortunately do not have a Snellen chart, so I am going to just test your peripheral vision. I'm going to have you look straight at me.
Mhm.
I'm going to move my finger to the side, and I want you to tell me when my finger goes away.
Okay.
So,
Gone.
very good. And the other side?
Gone.
Very good. It's pretty much normal. Alright, I'm going to test cranial nerve 3, 4, and 6 together, which is the ocular motor, the trochlear, and abducens. So I'm going to have you just follow my finger first. Down, and side, to side. Alright, and now I want you to follow my finger. Very good. And as I approached my finger to her nose, her pupils constricted, and when they came back out, they dilated back. As well as testing this, I am going to assess your pupils for reactivity to light. Alright, so if you just look at me. Very good. Very good. And her pupils are reactive to light bilaterally, and they are brisk when they react. Next, I am going to test cranial nerve number 5, which is your trigeminal nerve. I am going to place my fingers on either side of your, about right where your temple is, a little below that where your jaw joint is. And I'm going to ask you to open your mouth for me and close. Very good. And that moves bilaterally, so that is good. Next, I actually been testing your acoustic nerve this entire time, which is hearing, and I do not see any abnormalities in your hearing. Next is testing cranial nerve number 9 and 10, which is your glossopharyngeal and your vagus nerve. So I'm going to use this to depress your tongue. I'm going to ask you to say ah, and then I am going to put this back a little bit to test your gag reflex, okay?
Great.
So if you could just open up, alright, and say ah.
Ah.
Very good. And her pharynx does move when I do that. Alright, and you can open up for me again. Alright. Seems like your gag reflex is a little blunted, but that can be normal, or else you're just very good at hiding it. Alright, next I'm going to test cranial nerve number 11, which is your spinal accessory. I'm going to place my hand on the side of your cheek, and I want you to turn your head and try and turn your head against the resistance. Very good. On this side. Very good. I want you to shrug your shoulders against the resistance too. Very good. Both were equal bilaterally. And the last cranial nerve I'm going to test is your hypoglossal, which is basically your tongue. So I'd like you to stick out your tongue for me and stick it back in. Very good. And I want you to say the following words: light, tight, and dynamite.
Light, tight, and dynamite.
Very good. And you can hear the distinction between the L, the T, the D, and the N. And I'm going to do 2 more tests with you. I'm going to test your proprioception. So I'm going to have you stand up. And I'm going to have you stand with your feet together. I want you to close your eyes. Now this is called the Romberg test. This is testing her proprioception. I'm looking for any swaying, which she really does not have any. You kind of open your eyes. Very good. Your proprioception is intact. All right, and now next I'm going to do the finger-to-finger test your coordination. So I'm going to have you touch your index finger to your nose, and then I want you to touch it to my finger, okay?
Okay.
I'm going to just keep it in one spot for a little bit, but I'm going to make it go a little, I'm going to make it a little harder on
Okay.
you then. All right, go ahead.
With both hands or
No,
just one?
just one. Very good.
Good.
All right, so her coordination was very good. The movements were smooth and accurate. And that is my neuro and respiratory examination.